In a multi-casualty setting, the capillary refill test is the fastest and most effective way to check perfusion or circulation. To do this, press down on the patient's nail bed and release the pressure. The skin underneath the nail should return to normal color within 2 seconds if perfusion is adequate. If it takes longer than 2 seconds, categorize immediate and move to the next patient. The radial pulse can also indicate perfusion status. If you cannot feel a pulse, the systolic blood pressure has probably fallen below 80. The patient's legs should be elevated to improve blood flow to the heart, lungs, and brain, and the patient categorized immediate.
Put as much pressure you can on there. I need you to stop her bleeding, okay?
In situations where a patient has severe external bleeding, direct the patient or a bystander to apply pressure to the wound. If the patient has adequate perfusion, proceed to the third assessment to check mental status. On the START flowchart, the perfusion assessment looks like this. Check capillary refill by pressing down on the patient's nail bed. If color does not return within 2 seconds, categorize the patient immediate. Elevate the legs and control bleeding if necessary. If the patient has adequate perfusion, the nail bed capillaries will refill within 2 seconds and you will proceed to the third and final assessment.